With China battling a surge in respiratory illnesses, India is on alert and has decided to proactively review preparedness and measures in view of the emerging public health situation in China. China's health ministry has also urged local authorities to increase the number of clinics to tackle the rising cases.
China is battling a surge in respiratory illnesses. Cases among children are appearing especially high in northern areas like Beijing and Liaoning province. And in these areas, hospitals are warning of long waits. China's health ministry urged local authorities to increase the number of fever clinics.
It's very critical that one is that for the medical service sector, they need to develop so-called graded health admission system, because you have to avoid the sudden surge of patients and coming into the clinic and the hospitals. One of the problems is that when a lot of people coming into the hospital systems, actually the hospital could be overwhelmed by so many patients, and if you do not actually deal with the situation properly, there will be a lot of cross-infections.
The surge in acute respiratory illnesses is linked to simultaneous circulation of several kinds of pathogens, most prominently influenza.
This was always going to be a difficult winter, the first winter after the end of COVID restrictions. Remember, COVID restrictions, as well as stopping the transmission of COVID, they also stop the transmission of flu and many other similar illnesses too. So that's why we're seeing a lot more cases now compared to a year ago.
The Indian Health Ministry has issued an advisory and has decided to proactively review preparedness and measures in view of emerging public health situation in China. In a letter by Union Health Secretary to states and UTs, they have been advised to immediately review public health and hospital preparedness measures like availability of HR, hospital beds, drugs and vaccines for influenza, medical oxygen, antibiotics, personal protective equipment, testing kits and reagents, functionality of oxygen plants and ventilators, infection control measures in health facilities at a senior level. All states and union territories have been advised to implement operational guidelines for revised surveillance strategy in the context of COVID-19 shared earlier this year, which provides for integrated surveillance of respiratory pathogens presenting as cases of influenza like illness and severe acute respiratory illness. They have also been asked to ensure that the trends should be closely monitored by the district and state surveillance units of the Integrated Disease Surveillance Project, particularly of children and adolescents. As per the WHO, the release of COVID-19 restrictions coinciding with the onset of winter season have led to this surge. Bureau Report, DD India.
And Jessica Taneja now joins us from Delhi with an update on this story. Well, Jessica, is this, a unique virus or just a combination of cold weather-related phenomena?
Well, yes, cold weather-related phenomena, at least that's what we've heard from the National Health Commission in the recent past as to how this could be those pathogens that usually circulate around this time of the year, especially in the provinces of China, as the report mentioned, where it has seen concentration of, and of course, increased number of cases as well, as you pointed out earlier. So looking into all of these effects and how this particular influenza outbreak could be of some cause of concern, if not a lot at this point, the Indian government, as you also mentioned earlier, has issued an advisory preparing for caution and, of course, all the necessary medical aid and the infrastructure to be made available in case this turns out to be much more serious than predicted at this point. If you look at what the health experts are pointing out, they say that this is not a cause of major concern, because around this time we do see flus and, of course, influenza-like diseases, as it's called, or it could become a cause of concern if there are cases which are severe acute respiratory illnesses. So, of course, those will be a cause of concern, and the Indian government and the health ministry on that part has told the states that those particular tests need to be done, and that that lab data needs to be shared. And all those collaboration efforts are in place now.
Okay, indeed. In fact, I was going to ask you what preemptive steps that the government of India has taken, but they've also given an advisory to states to, be prepared. the question is, I mean, what are the ways in which this is being looked at? We've had the experience of COVID in the past, so this is like, reliving or just going back and tracing back our steps in a sense.
Well, that would be slightly premature to say on how this virus really, if it does in case spiral out of control. But for the moment, as I pointed out earlier, health experts do say that there is nothing to worry about. But yes, caution needs to be taken, as you also said. That in 2019, the world was taken aback, initial cases when they were reported. Of course, China not giving out much information also became a cause of concern, and the WHO pressing for more information. And a few days ago, as you saw, Mark, the developments that we witnessed, the WHO had asked for information about this influenza like flu, and of course, the details that should be shared with the world community at large so that everybody knows the specific details and how dangerous or rather preemptive steps could be taken to avoid such an outbreak. But given all of this context in mind, the Indian government has learned its as one were to put it, its lessons like the rest of the world at that time, in order to prevent an outbreak of that sort, and it's put those measures in place. Of course, at this point, not looking at the severity because there are just few cases, and of course, pneumonia in children being one of the causes of concern. So symptoms, if people do experience, which is common flu-like symptoms, should be reported.
We'll leave it there. Thank you very much, Jessica Taneja, for being with us. And of course, the simple old advice of wearing masks can help at this time as well.